Well, Frances, my late sister-in-law, lived in New Jersey, from which we came. And since we've been here, we've tried so hard to get her to join us. She lived alone, and she had no contact with neighbors. She wouldn't see a doctor. My son got off the phone with her one day and said, "I'm going to get her." He was up there for 2 weeks. She brought herself to the hospital, was diagnosed with 2 stage 4 cancers. Because she was too sick to make the trip, we hired medical transport, had an ambulance drive her from New Jersey to our home in Seguin. The driver and the 2 medical attendants kept calling us and saying she's crying. She said she's sick to her stomach. Does she have a doctor yet? I had just called hospice within half an hour before that call from the ambulance people. And I said, I'll call and see what I can do. I contacted them. They hadn't even finished signing her up. And they got Dr. Nolan to call in a prescription to a pharmacy that they were close to on the drive. I could not believe that hospice would kick in like that. The 3 months that she lived, she never had any pain. It was truly remarkable. The nurses were so attentive to her. They were, friendly and comforting, and they arranged for her to have her showers and baths and while she could still get up, and just did everything anticipating what her needs would be. They talked to her a little bit about what they needed to as far as her illness. Knowing that the nurses were coming was extremely helpful. There were times when we were frightened and they would speak to us. I mean, they spent as much time with us as they did with her. She went from being alone and in pain and afraid to having these people lovingly take care of her.